how 213 women with unexplained infertility were tested and treated, resulting in 42% of participants successfully conceiving and giving birth. This meta-analysis combines data from multiple published studies and reputable sources, including clinical laboratories, fertility clinics, and universities. While not all of the participants completed every step, we'll show you the complete process that enabled 42% of those who did to get pregnant and carry their pregnancies to full term. We'll cover how the women were selected, what they were tested for, how they were treated, their results, and finally, where and how someone can access the same tests and treatments. A total of 213 women who visited various fertility clinics, and for whom it wasn't clear why they couldn't get pregnant or carry a pregnancy to term, were selected. The tests they underwent. A total of 201 women were tested for human herpes virus 6A or HHV6A in their uterus using endometrial biopsies. After the biopsies were collected at their doctor's office or clinic, they were sent to COPA laboratories for analysis. HHV6A is a herpes virus. Like all herpes viruses, once infected, you carry it for life. This means that a couple could struggle, have a normal pregnancy, lose a pregnancy, and struggle again in any order, with success depending largely on whether or not the virus is active. Not to worry, there is a treatment available that we're about to discuss. HHV6A infections in the uterus cannot be found in blood or saliva. During the time of these studies, an endometrial biopsy was the only available method of testing. A recent breakthrough in testing now allows for easy sample collection at home, which we'll elaborate on later in this video. The test results. The biopsy findings are significant. Out of 201 women, 37% tested positive for an HHV6A infection in their uterus. In a separate landmark study, 43% of women with unexplained infertility tested positive, compared to 0% of fertile women. This means that at least 1 in every 3 women whose challenges were not understood had an HHV6A infection interfering with their efforts to conceive or maintain a pregnancy. The treatment. Treatment was given to 27 women, divided into 2 groups as follows. Group 1 consisted of 15 women with repeated implantation failures after IVF. Group 2 consisted of 12 women with unexplained infertility or recurrent pregnancy loss. All 27 patients were treated with acyclovir or valacyclovir, antiviral medications effective against HHV6A. Valacyclovir is converted into acyclovir in the body, so the active medication within the body was acyclovir for all patients. In Group 1, the 15 women with repeated implantation failures were given either acyclovir or valacyclovir. After starting treatment, repeat biopsies were performed at 1 to 2 month intervals. The initial round of treatment led to 5 out of these 15 women, or 33%, testing negative for HHV6A. The remaining 10 women underwent adjustments to their treatment, either a switch to valacyclovir from acyclovir or an increase in the valacyclovir dosage. Among these, 3 women had another biopsy. 2 showed decreased viral activity, and 1, initially unresponsive to the treatment, tested negative after an increased dosage. This highlights that with follow-up testing and by adjusting the treatment as needed, there is a good chance of success. In Group 2, the 12 women with unexplained infertility or pregnancy loss were given acyclovir over a period of 6 menstrual cycles. The pregnancy outcomes. Among the 12 women in Group 2, with a history of unexplained infertility or recurrent pregnancy loss, 42% became pregnant and carried it to term following treatment for HHV6A, without requiring IUIs, IVF, or hormonal interventions. 42%. That's remarkable considering their previous struggles. For those interested in getting tested, there are 2 available methods. 1. An endometrial biopsy, and 2. COVI. COVI is the simplest method of testing for HHV6A. It can be ordered online and delivered to one's doorstep anywhere in the US. To collect a sample, a user simply follows the instructions to collect 1 to 2 milliliters of menstrual fluid and mail it back to the lab. COVI is not only more convenient, it's also considerably less expensive since it doesn't require a doctor to perform a procedure. While we hope you don't need it, it's best to be prepared in case your period comes again. If it doesn't, return COVI for a full refund.